Okay, so the very last little bit of chapter 25 is actually not in the kidney. We've finally made it out of the kidney, hurrah. But once we have our urine made, how do we get it out of the kidney? How does the bladder then store it? And then how do we get it out of the body? So coming out of the kidneys are the ureters. That's what actually gets the urine from the kidneys to the bladder where it's stored. It's basically just a continuation of the pelvis. It has a 3-layer wall structure, so very similar to what we've seen before with blood vessels and so on and so forth. You have what we call a mucosa. The mucosa of the ureters is transitional epithelium, so it's those big bulbous cells that get kind of smushy when the urine flows through them. And then a muscularis layer, which is 2 layers of smooth muscle. And then adventitia, which is just some connective tissue kind of holding it all together. There are 2 ureters, one from each kidney, goes into the bladder, and if urine, particularly as the urine tends to fill the bladder, that increases the pressure inside the bladder, and if the pressure inside the bladder gets really high, basically the ureters will basically pinch off down there at those distal ends, so that urine doesn't kind of backflow up the ureters and into the kidneys. You would not want that to happen. The urine itself is basically just a big old muscular sac. Its job is to temporarily hold your urine. It has 3 openings, so 2 for the ureters that are more towards the top, and then 1 at the bottom. That's for the urethra, and that kind of triangular area there that's outlined by those openings is called the trigony. It's a very common area where infections of the urinary tract kind of start, and where they kind of get stuck there. If you look at the bladder versus when it is empty versus when it is full, you'll see it looks quite different. It kind of collapses in on itself when it is empty and gets kind of folds in the mucosa. Those folds are called rugae. A full bladder holds about half a liter of urine, but can hold up to almost twice as much if you are absolutely pushing it. So say you're on a car ride with your brother and he won't let you stop and use the restroom. Because of the transitional epithelium that can smush, and you can see when the bladder is full of urine, you'll see the rugae have disappeared, and the transitional epithelium, instead of kind of being big and bulbous, is kind of more flattened. That allows the urine to kind of accommodate that larger volume of urine if it absolutely must do so. However, it can burst if it does get too stretched out and distended, and that, of course, is not something that we want to happen. Leading out of the bladder is the urethra. So here's the kind of lower opening. Again, much longer in men than is in women, because in men it has to accommodate the penis. You'll also typically find your prostate gland, which is this little walnut-shaped gland that sits around the urethra internally, that of women is missing. There are 2 little muscular sphincters. There's an internal sphincter that's at the very base of the bladder, and then there's an external sphincter that's at the base of the pelvic wall. The internal sphincter is smooth muscle, which is involuntary. You don't have any conscious control over it. The external sphincter is skeletal muscle, so it's voluntary, and you get to choose when you open it. So when the smooth muscle of the internal sphincter is stimulated, it contracts. That opens the sphincter. The voluntary skeletal muscle has to, it stays contracted when you want it to. That's you holding your bladder. And you decide to relax your external sphincter. That opens the external sphincter and allows you to void your urine. The act of voiding your urine, the act of urination, has a term. It's called micturition. Typically, I don't know anybody who actually says that to their patient. Are you doing your micturition? It's usually urination or voiding, but it's really like a simultaneous events coming together that right, you get to actively choose when you want to void your bladder. Babies can't do that, and we're going to talk about why in just a second. But in order for urination to occur, you have to get the wall of the bladder to contract. That's stimulated by the autonomic nervous system. You have to get the internal sphincter to contract and open. Again, stimulation by the autonomic nervous system. And you have to get the external sphincter to relax and open, which is not the ANS, but the somatic nervous system, the voluntary nervous system. And we're going to kind of look at a figure here in just a second, but I want to talk about reflexive urination first. This is what happens with babies, because they can't hold it like we can as adults. The signal for micturition to occur is the kind of distension of the bladder, the stretch of the bladder. That excites the parasympathetic nervous system, and that leads to the internal and external sphincters opening in an infant. You have some centers in your brainstem that regulate when and when you do not void your urine. You have a storage center that prevents urination. You have a micturition center that stimulates urination. Those centers in your brainstem are not fully developed until you're about 2 or 3, which is why you cannot teach a child to potty train until they're typically 2 or 3 years old, because until that point, the reflexive urination is all they can do. If the bladder wall gets stretched, the ANS and the sympathetic nervous system, the somatic nervous system, both get stimulated, and both the internal and external sphincters open at the same time, and the child urinates with no control over it. Us adults, because we have those age-appropriate, well-developed storage centers in the brain, and not just down here in the spinal cord, so it's not just our reflex. We can actually take our brain and exert influence on the reflex. Then we can choose when and where to void our urine. So when the bladder fills with urine, that stretches out the bladder wall. That stretch is sensed and activates this reflex arc. That leads to increased sympathetic activity, increased parasympathetic activity, decreased sympathetic activity, and decreased somatic activity. So the increase in parasympathetic activity and the decrease in sympathetic activity means the muscular wall of the bladder contracts, the internal sphincter opens, and because we have decreased activity of our voluntary skeletal muscles, the external sphincter also opens, and we void our urine. But when we are of sufficient age, 2 or 3 years old, the storage center here can influence the kind of reflex arc that would result in urination by decreasing parasympathetic activity, increasing sympathetic activity, and increasing activity of the voluntary skeletal muscles, such that we don't void our urine. And it is not until we consciously choose to void the urine when it is appropriate to do so that we will then void our urine. And that is the end of chapter 25.